I'm Dr. Christine Lee, and I'm a surgeon here in the Swedish system, and I specialize in breast surgery and breast cancer surgery.
I'm Dr. Tanya Wall. I'm a medical oncologist at Swedish Cancer Institute in Issaquah.
There's this sense that there's an emergency.
Most women probably should slow down. A lot of women, when they are first diagnosed, the sort of knee-jerk reflex is, oh my gosh, get it out of me. And the truth is, it's been there for a while, and nothing is going to change drastically in coming days and weeks, and so they have time to make an informed decision about how to be treated. A reasonable time frame between diagnosis and surgery is usually within about a month. There can be a lot of workup, so even 2 months is perfectly fine for the vast majority of patients. But so many women feel like, from an emotional perspective, they want surgery faster than that. I feel like what I hear from patients very often is, why do I have to wait? And we, as the practitioners, we want women to be informed. We want them to understand their options and the ramifications of the decisions that they make, and for them to realize that they really do have choices.
So we have several options for the surgical treatment of breast cancer, and in general, we're choosing between preserving the breast versus sacrificing the breast in the form of mastectomy, with or without some form of reconstruction coordinated with that. Exactly what type of cancer is this? Is this a ductal cancer versus a lobular cancer, for example, which are two of the most common types of cancer that we see? Is this an invasive cancer, otherwise known as infiltrating cancer, or if we caught this before it's an invasive cancer, in which case we would typically call it in situ cancer. In situ cancer is something that's typically limited within the confines of the ductal elements of the breast, and in that it has not gained access yet to the bloodstream or to the lymphatics, which means it has no risk, virtually no risk, of getting outside of the breast tissue. That word invasive or infiltrating is a very scary word, and it does mean that it's a kind of cancer that has the potential to do that, but it does not mean it has done that at the time of diagnosis. And the vast majority of those women will not have any cancer outside of the breast when they get their initial diagnosis of invasive breast cancers. We're often not going to know the extent of the cancer until after surgery, when we have the final surgical pathology available.
In breast cancer staging, there's often a number and a letter, and it has to do with the size of the tumor and the nodal involvement. And every stage is a combination of nodal size and tumor size. The only exception is stage 4, which is any metastatic site gets you stage 4 disease. And that's the only stage that's not curable, unfortunately. But everything short of that is curable to different degrees.
Grade is really about how the cells look like under the microscope. So how ugly are they relative to normal cells, or how close to normal cells do they appear? So the best way to explain that is really that word. Are they kind of ugly? Do they look more aggressive or not? People often think that the type of surgery they have in their breast will impact whether or not they need to have chemotherapy, and typically there's no relation one to the next.
I can't really tell a woman, many women, I can't tell them very confidently whether or not they need chemo until surgery has happened, because so much of that decision making is dependent on the pathology that the surgeon finds. No woman with non-invasive breast cancer, which is often called DCIS or breast cancer in situ, is going to get chemo. And in fact, many women who have invasive breast cancer are not going to get chemotherapy either. There's no question that chemotherapy is the hardest part of the treatment that we give to patients with cancer. There's no question that there can be long-term risks and long-term effects. Most patients eventually get back to a normal state of health. And that should be the main thing that they take home with them from an appointment, even though they may have months of not feeling as well as they would like to. The goal is to prevent them from having a deadly illness. Radiation generally is a very easily tolerated procedure for breast radiation. It's long. Typical radiation is about 6 weeks, but the way they can deliver radiation these days, the side effects are so limited. Few women have much more than minor burning of the breast. It's very rare to have any breakdown of the skin, and fatigue is usually very limited. It's actually rarely needed in women who have mastectomy. And that might be one of the things that goes into a woman's decision-making about lumpectomy or breast-preserving surgery versus mastectomy, is their desire to avoid radiation or their comfort level with having radiation. Starting anti-estrogen therapy is always the last thing. I kind of think of breast cancer treatments as cassettes, surgery, chemo, radiation, and estrogen, anti-estrogen therapy. And some women need all four, but many women need surgery and maybe nothing else. And if you don't need one of those cassettes, you just sort of drop it out and everything else moves forward. We have 2 tumor boards weekly at Swedish just for breast cancer, where all of the experts who are involved in taking care of patients with breast cancer sit together and review cases.
One of the best things about Swedish in delivering cancer care and the Swedish Cancer Institute network across the various campuses is that women have full access to comprehensive multidisciplinary care with all the right specialists, all the right know-how, all the right technology. They can get it delivered to them in their community.
There's absolutely no right answer for every woman. As a woman who has these choices to make, you just need to be able to make them in a considered way. You just need to not be rushed into it, and you need to be able to account for your own values in the context of doing the right thing for your cancer treatment.